Hi, I'm Dr. Jonathan Klar. I'm a board-certified chiropractic neurologist, and I'm also a member of the International Association of Functional Neurology and Rehabilitation. And I'm here to tell you that no stone is going to be left unturned to figure out what the exact cause of your migraine headache problem is. I pride myself in being up to date with the newest procedures, the latest treatment, and the latest continuing education to get chronic pain cases better. And that's what we're going to talk about here in this brief presentation. So, what do we do in our office that makes us different? Well, there's a lot of things we do in our office that makes us different and how we handle these kind of cases. But we got to understand that all kind of chronic health conditions really have some kind of common thread with them. Whether it's fibromyalgia, whether it's a vertigo case, sciatica, a disc case, a peripheral neuropathy, a chronic neck issue, a digestive issue, they all have some kind of form of oxygen deficit. There's some kind of neurological misfiring going on. There's a metabolic imbalance, a blood sugar issue, there's an adrenal issue. So there's something going on with them neurologically, there's something going on with them metabolically as well. So it depends on which individual as far as how much of each is really contributing to this. So analyzing you and telling you some people, a majority of the problem is a neurological issue. We handle that accordingly. So there's no one clear answer for each condition. So what we need to determine is if you've been diagnosed with migraine headaches, you're probably very frustrated, okay, because you've been to the emergency room, you've probably had the pain injections, you've had the MRI that says everything's fine, there's no problems, and maybe you've just been given a preventative dose of medication to learn to live with this stuff. There is hope with this, and that's what we're going to talk about. But you need to understand exactly what's causing this issue itself. So the cause really for a migraine headache is there's an increased need for fuel somewhere in the brain. So the brain is activated and it needs an there's an increased need for fuel. So neurotransmitters such as calcitonin and bradykinin are released, okay? And they should have a vasodilation. So that increased need for activation or fuel should be met with an increase in dilation of the vein, or the vessel rather, to get more blood supply to that area. But for some reason that doesn't work properly. And that's when you start feeling that prodrome, or what we call transient ischemia, where you see spots that aren't there and you might smell something that isn't there as well. So more neurotransmitters are then released to try and activate this pathway so we can get more of a dilation that didn't occur yet. So now we get a greater dilation now. Instead of getting a normal dilation like we should, we get a greater dilation even though it's delayed. And this is what's responsible for that pounding problem you feel in your head. So this is a neurological issue. A migraine, the actual headache, is just a symptom of what's going on in the brain. But eventually what's called your sympathetic nervous system will fire, and that'll decrease that blood flow to that area and cause some suppression of the symptoms. So another area of the brain that's being infected is what we call the mesencephalon. So the mesencephalon is the area that's located up and through here. It's called your brainstem, the upper part of your brainstem. And this area is kind of like an unruly teenager that chronically needs to be watched and taken care of. A high-firing mesencephalon leads to all kinds of problems, headaches being one of them. The second thing being fibromyalgia-type symptoms, chronic pain. This has a lot to do with our blood vessels dilating. And when those blood vessels dilate, you have nerve fibers that surround the vessels, and that's what causes that nociceptive input into the brain that things aren't right and causing pain and sensations. So again, we get the rebound over dilation, the throbbing pain, we get the light sensitivity as well. So why is the question? Why are you having this abnormal neurological firing? Is it because of trauma? Is it spinal issues? Is it temporomandibular joint dysfunction? Is it metabolic issues? Is it sensitivities? That's really what we need to uncover, is what's really causing these problems for you. And we need to look on places where other people obviously haven't looked. So the two things that your body really needs to function properly is it needs fuel and it needs activation. And fuel comes in the form of the foods that we eat, such as glucose, and the air that we breathe, such as oxygen. Activation, that's kind of like exercise for your nervous system. Let me jump back to fuel, because again, fuel is very important. If you're skipping meals, or if you have high or low blood sugar, okay, that's not good. That can be contributing to your problem, okay? So again, activation is like exercise for your nervous system. We're receptor-driven individuals. So our brain constantly grows and thrives on the information we give into it. If we don't get information in, we're not going to get information out, or good information out. Case in point, there was some research done with some college students, because college students will do just about anything for money. But what they did is they compared two groups of college students. And they immobilized one of the group's left leg in the group from the waist down, and the other group they didn't do anything with. But prior to doing that, they measured the area of the cortex, of the brain, that's responsible for basically registering that left brain. So that would be right up here in the right part of the parietal cortex up here. So pre and post, with the group they did nothing to, they obviously didn't see any changes neurologically with them. But the group that they immobilized for a short period of time, they found that there was already decreased activity in the brain and started to show some what we call neurodegeneration, or decreased frequency of firing, just within a few 2 weeks of doing that study. So what this tells us, folks, is if you're a chronic pain patient and maybe you have difficulty turning your neck, or you've been guarding an area for a while, those receptors in those joints aren't firing properly, consequently the brain is going to suffer. This increases your chance of developing some kind of neurodegenerative stuff down the road because our brain is not thriving as it should. So your nervous system basically can create compromise rather of your brain stem, your spinal cord, and then it goes all the way down into your spinal nerves. So the nerves come out here, your neck, go into your neck and shoulders and all the way into the fingers. Same thing in the low back, they come out and control your low back muscles, your thighs, and all the way down to your toes as well. These nerve supply controls everything that goes on in your body. So this is all controlled, again, by what we call the central nervous system. That tells our body what to do, how often to do it, and how to respond to certain stimuli. The brain makes decisions based off of the information it gets. Okay, so if we have faulty information coming in, again, faulty decisions will be made. So looking at the brain itself, if I was to turn sideways here, you would see this area up in here primarily is what we call the frontal lobe. Okay, this area up in here is called the parietal lobe. We have the temporal lobe and the occipital lobe. So again, frontal lobe here, this is what really separates us from beasts. This gives us our higher cortical thinking, our higher cortical functioning, our ability to choose which movements we want to do, our ability to stay focused and attentive on something, our ability to shift our attention away from something, our ability to have proper reactions and social experiences. Your parietal lobe is your sensation lobe. So if I take a pin and I prick it on my left finger here, that message travels up my arm into my cord, and then eventually comes over here to my parietal lobe on the right-hand side. The temporal lobe has a lot to do with memory and hearing as well. The occipital lobe is where our vision terminates. The area down here at the back, at the very bottom, is called our cerebellum. And your cerebellum is actually a very rich, oxygen-rich hog that consumes a lot of oxygen in your brain, consumes the most actually of your brain. But it's responsible for fine motor movement, okay, and the ability to control all your postural muscles in your spine. So we see a lot of people that have problems with migraines have neck dysfunction, okay, and there's a breakdown in the core muscle stability in there, and that can be contributing to what's going on with this migraine headaches. So it's important to understand, a little bit of background on how the brain works and what these things are doing and why things are occurring the way they are. So back to the upper brainstem area, or that mesencephalic area. That's the controller of what we call our sympathetic nervous system, or our fight or flight nervous system. Fight or flight nervous system, when you're walking through the woods and then a bear jumps out at you, you've got two options. You're either going to fight or you're going to run away. Okay? Hopefully you'll run away. But basically, that's the branch of the nervous system that's responsible for getting our heart rate elevated. That's responsible for our activating these kind of pathways. It's responsible for being awake and alert. That's called our reticular activating system. And this area is also responsible for what we call dopamine production. Dopamine is your happy neurotransmitter. They actually did some research, and they took these monkeys, and what they did is they had them hooked up to contraptions where they could either choose to have a shot of dopamine, or they could choose to hit a lever and they would be fed. They'd be fed. And dopamine has such a strong reaction, they just kept hitting the dopamine lever until basically they starved to death, because it has such a high increase in your neurotransmitter, increase in that ability to feel good or euphoria in your body. Well, these areas, this dopamine production, this reticular activating system, this is located in this upper brainstem area. But what happens is, your brain's not supposed to be firing that way all the time, or more dominant than not. So does it sound like you should be healthy if you're constantly in a state of fright and panic? Obviously not. This is why migraine headache cases usually have problems with sleeping, okay, because the reticular activating system isn't working properly. They usually have problems with sweating in their hands, extremities. They usually have problems with urinary tract infections. They're often diagnosed with chronic pain syndromes and fibromyalgia. This part of the brain is overactive, and we have to slow that down. How we slow that down is basically activating the frontal lobe, which decreases the firing in that area. So that's one of the ways we can do that. So Upper brain dysfunction, again, can lead to chronic pain, light sensitivity, insomnia, things like restless leg syndrome, migraines, and fibromyalgia. There's an area also in that area, it's called, in the brainstem area, it's called the periaqueductal gray region. And that's responsible for basically decreasing pain. What that means is mechanoreception inhibits nociception. If we can increase the firing of joint receptors, we can decrease a lot of pain that we're feeling, okay? And also stimulate and fire that periaqueductal gray region in the brainstem to decrease pain, which is obviously what you as a migraine headache case would like. So emotional stress leads to something being released in your body called cortisol. I'm sure you guys have all heard about this, but excess cortisol in the body is toxic to the brain, causes problems with memory, and that's what's responsible for kind of that hazy fibro fog feeling patients will get, is it's a chronic stimulation of this area producing that cortisol causing these problems. So again, when we have that overfiring mesencephalon, there's some pathways it goes through the what's called the IML to stimulate the heart. It's going to increase firing, and it's going to stimulate things being released in your bloodstream such as catecholamines and norepinephrine, which again cause stimulation of the brain or the type C nociceptive fires. So in other words, what happens is when this area keeps working, it's stimulating things that cause more pain. That's basically what this is getting at here. Some interesting things